Hi, I'm Dr. Sulata Shenoy, Psychologist and Director, Turning Point, Center for Psychological Assessments, Therapies and Counseling, Jayanagar, Bengaluru. In addition to COVID-19 having devastating effects on people and nations' health and economy, the third factor which is emerging very strongly is the impact on people's mental health. So we are seeing a large number of people who are increasingly anxious, depressed, worried, stressed out, and this can have not only temporary but also long-term effects on their general outlook on life and mental health. Most of us have known one or another person who has suffered or died from COVID-19. And as the cases continue to surge, in addition to the persons who have themselves undergone suffering from COVID-19 or the caregiver stress around the patient, there are also a large number of us who just by hearing the news or just by seeing cases or understanding from social media or the print media or from conversing with friends about the effects and impact COVID has had on people, have gone into severe shock like anxiety or worry. So this inhibits a person from doing even the day-to-day activities. Now, doctors have been telling us from day one that we need to take certain precautions, we have to be careful, and we need to understand how the virus works and try to go about our day-to-day lives in as normal a way as possible in spite of taking all these precautions. Now, there are a large number of people who are so worried or anxious about contracting the disease that they totally seclude themselves, they refuse to come out, they refuse to have any kind of normal activity, and this has had serious effects on their mental health. So the only way is to understand how one can deal with COVID. So we have had enough information about that. One thing I'd like to stress is that we need to see which information is authentic and helpful and which information is more of scaremongering, rumor mongering or downright damaging and deleterious to your mental health and your general lifestyle. So you need to know what precautions you have to take and not fall into the trap of excessive viewing on social media or TV or the news, or talking to friends and family endlessly about the dangers of the disease, and make your own decisions about how safe you are and how you can maintain safety along with balance in life. So this will go a long way, because I think we come to expect the pandemic to stay with us for some more time, and we now need to look at how we can lead normal family lives, normal lives in our work situations, as well as maintaining some kind of friendships and keeping in touch with our resources as before, in order to maintain your mental life along with your physical health.